Hi one and all, welcome to PAL Osteopathy and Massage. We've made this video as a way of trying to answer some of the questions that I get asked a lot of about my training and osteopathy in general. So without further ado, Sarah's going to start interviewing me.
Question. What is osteopathy?
An osteopath is someone who believes that everything within the body works together. And if there's any alteration in one body part's structure, it will affect its function. So a common example I often give is if your feet are rolling inwards, this will affect the knees, they will get pulled inwards, and the hips could internally or externally rotate depending on the individual. So an osteopath is someone who will view you more globally.
Next question. How would you describe yourself as an osteopath?
Being a British trained osteopath, we are trained very thoroughly that examination is key. So when I see a patient, it's a very detailed case history exam. Example would be what it is you're coming in with, how long you've had it, what makes it worse, what makes it better, other modalities that may or may not have worked. And then I'll proceed into an examination based on the intake of what you're coming in for. We really try and hone in on what the tissue-causing symptoms are, and sometimes this can be confusing for a patient in that they're coming in for lower back pain, but a well-trained osteopath is examining their feet and if the dysfunction is coming from further afield.
What is your training as an osteopath?
My training is that I'm a British trained osteopath through College of Osteopaths in central London and accredited through Middlesex University. My training is a 5-year medical degree and I qualified with a Bachelor of Science with honours in osteopathy. Within the training in England is a heavy clinical element. We have to do minimum of 1,500 hours and many qualifying osteopaths, myself included, will finish with at least 3,500 to 4,000 hours. This is complete within the clinic environment and is hours spent observing and treating patients.
How did you come to osteopathy?
I'm glad you asked me, Sarah. That's a very good question. I came to osteopathy from seeing an osteopath, a local osteopath who's now sadly passed away, John Bird, and I had had a couple of motorbike accidents. I'd had a very bad accident involving being run over by a London double-decker bus, and was suffering very bad headaches and neck and shoulder pains. And I went to see him, and his examination of me was amazing. The treatments, I left and was instantly relieved. And very shortly after that, I started inquiring about how I could switch professions and try and study this amazing art form.
What things did you do before this?
So I had quite a colourful career before osteopathy. I started off as an insurance medical underwriter, then progressed into the trainee trader scheme with the same insurance firm. I then went off and did the knowledge to become a London black taxi driver, which thankfully enabled me to carry on and do the studies to become an osteopath at the same time.
So the big question, what is the difference between osteopathy and chiropractic? Okay,
so I get asked this one pretty much. I lose track of it, how many times I get asked this question. I always say it's very hard for an osteopath, chiropractor, physiotherapist, any manual practitioner to answer this question because we haven't done the other person's training, so you don't get to answer it honestly. What I always try and guide patients towards is it's more important to find a practitioner that possibly if you've heard good things about, so trusting your friends and colleagues, Google reviews as well, that the person clicks with you. I would also go as far as say you've got to find that practitioner that actually listens. There's a lot of practitioners out there of many different professions who will try and rush through an examination and even a case history taking and get you into treatment quickly. I think it's much more important that you find the right person who listens to what's happened to you, examines you, tells you what's going on and what likely is going to happen with treatments and a rough idea of how long this may take. I think that is a lot more important than what's the difference between this profession and that profession.
What makes you different?
I'm a British trained osteopath currently working in Ontario, Canada. I have, as the British training is very medically orientated, we are very well trained on the examination of the musculoskeletal system, and we also have extensive training in the cardiovascular, respiratory, as well as the visceral system. We can read x-rays and other imaging, and we are taught and trained with basic blood tests. Myself, I take the examination side of things very seriously, and I am very upfront that I will not cut corners or skimp on time on examining someone in trying to rush into treatment. So a big difference with me is we will spend a lot of time discussing what it is that you're coming in with, examining it, so that I can save you time and money in future treatments. Other things I've done in the background is something I would actually guide you towards trying to find as a practitioner, someone who's always doing continuing training. I've done the appetite acupuncture training, and at the time I was the only osteopath in Canada to complete this. I've done the suction cup therapy courses, Graston Master Level 2 practitioner training, as well as just completed the Master's Level 2 of the McGill back rehab protocol training.
What do you like to do outside of the clinic?
Well, I'm being interviewed by my wife, so what I like to do is what we like to do. So I love boxing. I've boxed since a young child, so I box regularly, just regular Western, just fists boxing. I am a climber, so we both rock climb and are both avid cyclists. And I would like to say cooking, but I'd be lying.
Big lie, big lie.
Can't stand cooking.
Will there be rehab exercises given?
Yes, with myself, the majority of times I do give rehabilitation exercises. I have done the Level 2 Master's training with Professor McGill on back rehabilitation. So if you are someone who is coming in for our big back assessment, you 100% will be given rehabilitation exercises, and it's in your interest to do them if you want to get better. For the majority of other patients, I will help and advise you on correct exercise strategies to get you not only better, but keep you well. Being an osteopath, I also have a limitation with rehabilitation exercises, so often there is only so far that I would be able to take you as an osteopath. We're a more manual healthcare practice. However, I do have very close relations with several physiotherapists in the area. We've built up a very good relationship where we'll do handover notes and we'll do a collaboration in the background so that your care continues if more rehabilitation exercise is deemed appropriate.
With your osteopathy practice, how do you work with the massage side of the practice?
So my wife. So one of the great things about having Sarah work here is that Sarah came to it. Actually, this is going to be in one of our other videos, so you might see that down below or above the playlist, how we work together to look after you. But simply put, Sarah didn't just come at this from no background. Sarah has had years of training in yoga and yoga therapy, did over a year's worth of training of osteopathy before transitioning to the massage therapy. So it's great for me if we feel with the patient that more soft tissue massage is appropriate. We have a collaboration with the patient's consent in the background that, look, we need more soft tissue work on that lower back, shoulder before progressing back into myself. And it's been absolutely amazing that when someone has concluded their care with myself, that we have massage in-house with Sarah, who can say, look, you work at a computer all day, it's probably a sound idea to pop in once a month for appropriate time and get that neck and shoulder taken care of so it doesn't become a problem in the future. The added bonus of it is we're body geeks, so this is kind of what we talk about even when we're at home, is how best to look after people.
I think that's about it for now.
Well, until the next time, we hope you all stay fit and well, and remember, health is wealth and
movement is medicine.